Despite evidence that hospice care can greatly extend and save lives, studies show that few African Americans and Latinos take advantage of it. But the family of 92-year-old Hannibal Waite put aside their fears and allowed the Visiting Nurses of New York Hospice and Palliative Care to care for Miss Waite after she decided to get surgery. They now call it an extension of their family that has made a world of difference.
They have made life so much easier for us. And always right here for me. I tell you, it's just, I just can't describe how I feel, how they make me feel. It's just so wonderful, wonderful, wonderful.
Israel, Jordan. Oh my goodness gracious.
As Johnny Cash says, you've been everywhere. All right.
I'm gonna let it shine, let it shine.
One of the things that, as a registered nurse, I evaluate here her vital signs. We ensure that if she is experiencing some symptoms, maybe some shortness of breath or pain, we are available to her and to the family to ensure that we can provide the teaching that's necessary to ensure that she's kept comfortable here.
I'm gonna let it shine, let it shine, let it shine.
She's a perfect example of somebody who is able to maintain a quality of life through hospice services being in place at the correct time, so that she's able to enjoy her time with her family and her friends and the holidays and things of this nature.
Here today to address the issue of hospice care and minority communities is Rosemary Bond, the Senior Vice President of the Visiting Nurse Service of New York Hospice and Palliative Care, and Amelia Blake, a registered nurse and quality manager with the Visiting Nurse Service of New York. Welcome to both of you.
Thank you.
Reading about this subject, I, quite frankly, was stunned that there seemed to be such a disconnect with between what hospice care really is and what people think it is. You've been doing this for a couple of decades.
Yes.
Has it gotten better, and why does there seem to be suspicion among some communities?
Yes. To answer, it has gotten better, but over the many decades, we're still not there. Only 82% of hospice enrollees are Caucasian. We're only 8% African American. There's good evidence and support from the National Hospice and Palliative Care Organization around that work. And so a lot of mistrust in the community, lack of education, lack of awareness, spiritual care needs and myths get in the way. Many folks are seeking miracles and see that hospice gets in the way of that, where it really can become an extension of the care. So an important message for us to communicate.
How are you guys trying to sort of bridge that gap? And a lot of times you have to, sometimes they say speak to people where they are.
That's
to
right,
try to get through to.
So we at the VNSNY have developed a HOPE project that's rooted in Harlem. HOPE stands for our Hospice Outreach Provider and Patient Education Effort. And we're working with community stakeholders, religious leaders, the Harlem Hospital staff, and many in the community to really get out there in the trenches and get the word out.
These people, they know who to connect with and how to connect with them.
That's right.
Now, Amelia, you are really focused on home care.
Right. We provide the education and some of the care to the patients at home.
What is it that you do every day?
Home care. We provide registered nurses, physical therapists, occupational therapists that go into the home and assess that home environment for that patient. We help to transition patients from various healthcare settings, such as hospitals or nursing homes, and help them adjust to that home environment with their new illness.
You know, a lot of people, when they think about hospice, they say, well, oh, I thought they take you somewhere. So what you're, that's a big difference from what a lot of people, their perception is. It's not just, if I say I enter hospice care, that means they're going to come to the house and give me, and you're never going to see you, me, or my loved one again. That's not what it is.
Right.
Quite the difference.
Yeah.
The difference is that we bring the care to your home, and you're in charge. And so it's different from hospital and other medical settings where physicians and other care staff were in charge. And when we are in your home, you develop the plan of care with your family and with your care team. And that, I think, having done this work for so many years, is really the magical difference. So when we step into someone's home, it's their ability to make things the way they want, to have the food they want, and get up in the morning when they want. And we help them from the hospice team by providing the full care team.
Yeah.
So the hospice team, the nurses and the social workers, chaplains, volunteers, sort of a difference and an extension from the home care is the real interdisciplinary team.
Yes.
And I like to call it the best kept secret in Medicare. So it's a rich benefit that folks don't take advantage of because they're afraid of the word.
Yeah.
And they're really, by us calling this effort hope, we're seeing people that wouldn't listen before, listening. And so using words properly and in a way that mean things to individuals, looking at health literacy and how people hear about health information, is a really important part of our HOPE project.
And I think the thing is, too, is that, you know, when you have someone at home, you think, well, I'm giving them care. But especially with certain sort of illnesses, you do need a level of expertise that hospice care can provide in addition to all that love that the person is getting with their loved ones.
Our clinicians are skilled in pain and symptom management, and pain management is such an important part of how people worry that they're going to be in pain. If you ask people to describe how they want to live their final days, they first say they don't want to be in pain. So our trained experts in pain management help people become comfortable with the pain and physical symptoms so that they can then go on to address spiritual and psychosocial issues that are important.
And we should mention that Hannibal Waite, the woman you saw at the top of this show, that her family was taking advantage of the hospice care, she died just a few days ago. And again, her family says that hospice care made the last few days more bearable for them and for her. We want to thank you both for being with us this afternoon. Now, if folks want to find out more about what you guys do, hospice care and other visiting nurse service of New York programs, they can go to VNSNY.org.
That is correct.
All right. Thank you both. You know what? This is a conversation I'm sure that we should have again, because it really is an important benefit that more people should take advantage of. Thank you both.
Thank you. Thank you.